my name is Jordan Hollowell, and I'm going to be demonstrating how to do an IV push drug administration. Some of my things are already going to be used because I've had to try to record this video more than once to get it to upload. So with that being said, the first thing I'm going to do is verify my MAR. For this patient, we have a Renee Adams. Her date of birth is 5/25/78. She has been ordered furosemide, and it is in a 10 milligram per ml solution, and our dose is 20 milligrams, so that's going to be 2 mLs, and that is to be given every 12 hours. It's going to be administered over 2 minutes with a 3 ml flush before and after the drug administration. I have already gathered all my supplies. I have my hand sanitizer in my arm, my disposable bucket for sharps, alcohol pads, gloves, needle, syringes, medication, and flushes. So the first thing I'm going to do once I get my medication is just check the expiration, make sure that it is in date. And this is going to be my furosemide. It's in date. It's a 10 milligram solution per ml. So I'll go ahead and do my hand hygiene and get this all prepped. So what I did, these flushes were in 10 ml solutions. I went ahead and I pushed all the excess flush out and had them both at 3 mLs. So this is my 2 3 ml flushes. And then I would go ahead and I did wipe these down, both of those, with the flushes after. I'll go ahead and just, and now that I have my medication, I'll take another alcohol pad, get it all clean. And after wiping anything down with the alcohol pad, I would wait 10 to 15 seconds to let that dry, make sure it was good. All right, here is my syringe and my needle. All right, and normally what I do, I'll go ahead and draw it up to 2. Push that 2 there in. And then I'm gonna go ahead and draw up because our dose is, per the MAR, it is 20 milligrams per 2 ml, and this is in a 10 milligram per ml solution of furosemide. So I'm just gonna go a little bit past the 2, and then I'm gonna push it back right up to that 2, just to make sure we have the 2 ml. I'll do that. So now we have our medication that is ready. So at this point, I would go ahead and go into the patient's room. Hey, my name is Jordan. I'm going to be your nurse today. I do have your medication that the doctor has ordered for you, so I will be going ahead and administering that right now. Do my hand hygiene before getting ready. Put on my gloves. Before I did anything excessive with the patient, I would, oh, I lost my band. Just re-verify her name and date of birth, and she tells me her name is Renee Adams, date of birth 5/25/78, and I'll just re-verify that while looking at her wristband, because I am going to come over here and check the IV site for redness, swelling, infiltration, make sure that the site is still good and accessible, in which it is. So at this point, go ahead, unclamp that, and get everything ready. Okay, and we'll go ahead, clean this port, let it dry, and aspirate on this IV line, pull back for some blood. I am getting it. And then I'll push my first 3 ml of normal saline, in which everything is still flushing smoothly with that. And I'll clean my port off in between every time we have to push something on there. Here is my med. I'm just going to make sure it's still at the 2 mLs. And at this point, since this medication is administered over 2 minutes, I would explain to the patient, hey, this is going to take 2 minutes. You know, I'll be right here pushing this medication. And I'll go ahead and go. So we're going to be doing 0.5 every 30 seconds is what our goal is going to be. And I'm just going to keep an eye on this line just to make sure nothing crazy happens or infiltrates. And also just communicating with the patient since I am going to be here for 2 minutes. And we are at the halfway mark here. So just 1 more ml to go, Miss Adams. Just a little bit longer. We are almost done here. All right, Miss Adams, that has been pushed. And then I'll go ahead and follow that up with our 3 ml syringe of normal saline. And again, every time I'm pushing anything, I'm just reassessing the IV site to make sure no changes are happening and to make sure it is still good, and which it is. So now that that is done, I'm just gonna re-clamp this PRN here, and she is good. And then I would just make sure the patient is comfortable, see if she needs anything, and make sure she does have her call button in case she needs us for whatever reason. And before leaving, you know, just making sure she's good. So I would go ahead and discard of that after cleaning up everything, do my hand hygiene, and leave the room. And then at this point, I would make sure to document everything as it happened within the chart, the time, and everything else. Thank you.